yeah, as a pediatric surgeon, I'm a surgeon and my specialty is pediatric, so pediatric surgery. So I deal with children, especially na mga bata na kailangang operahan. You know, napaka-extensive kasi ng ating mga management, especially we have a hospital like the Philippine Children's Medical Center, we have also the National Children's Hospital. These are hospitals catering to the pediatric cases. Now, usually, ang ating mga cases na ganun, sabi nga ni Doktora, siguro because of the very extensive studies ng mga pediatric cases, napagtutuunan talaga ng pansin. And there are so many foundations helping us. It's not only the Department of Health, but other component societies that are helping us to really information dissemination, and we see also a lot of support coming from the private sector, together also with the government, so it becomes a public-private partnership, as they call it. And then, sa bata kasi, very, very specific yung ano natin, because as we all know, pag silang pa lang ng isang sanggol, siya ay napapollow up na. Di ba? So, kumbaga, nakakatch kagad. Pero titignan nila, hindi naman masyadong common ang cancer in children. That's not true. Meron nga, marami ang cases, but very responsive sila. Another thing, siguro when it comes to dosage at saka yung medyo hindi naman ganun kalaki ang dosage na kailangan, and of course, napakadali ng yung advocacy when it comes to cancer in children, especially. Kaya makikita mo, lahat ng mga foundation, lahat ng mga support nasa atin. Kaya, kumbaga, it becomes more, parang tumutulong ka na, and then public awareness, and then nandun dun yung, yung sa ating mga hospitals, pumapasok din, especially sa mga corporate hospitals natin. We have, under our care, sa Department of Health, nandyan ang National Kidney and Transplant Institute, nandyan ang Philippine Children's Medical Center, nandyan ang Heart Center, Lung Center, and KTI. But, ang magandang aspeto dito is that the awareness, the public awareness, at saka yung modalities ng caring for the children is very extensive. Kaya nga, maraming natutulungan. At maraming umaabot sa mga hospitals natin. There was even a study, sinasabi nga, even our president, sinasabi nga na a certain percentage are not even seen by a doctor. In recent studies, parang sinasabi na, for the information of everyone.
Or just wave your hand. Thank you for joining us today. And our second panelist is Dr. Rosalina Anastasio. She is currently the president of the Philippine Society of Pediatric Hematology. Also with us today, thank you sir for coming, is ASEC Elmer Punsalan from the Department of Health. Okay. Our next panelist is Melvin Lee. No, isa din po sa pinagmamalaki namin ang pagkakaroon namin ng partisipasyon sa pag-produce ng isang dula. No, natatalakay po sa mga storya ng mga pamilya na nag-undergo ng kanilang struggle and fight against cancer. At narito po si Melvin, siya po ang director, stage director ng Montesa Angola. And of course, this event will not be possible with the ever-continuing support of our partner, Sanofi. And with us today is Attorney Darwin Mariano. He's the Director of the Public Affairs and Communication. Okay, so at this point, I'll open the floor for any questions. So later on, while we are waiting for Dr. Lecciones to present his take on this theme on the World Cancer Day, I'll open the floor first to questions. Yes, Ms.
Kung merong oncogenes, kumbaga, it's just sitting there, nag-aantay lang po ng tamang trigger, at pwede ho yan dumami o mag-produce ng cancer sa sarili nating katawan. Kaya lang po, may mga factors po kagaya po ng mga congenital abnormalities po. Pag may isang tao may congenital abnormalities, at the same time, ma-expose siya sa mga environmental factors na lalong makakapagpasama sa kanya. yun ho ang pwedeng maging dahilan kung magkakaroon siya ng cancer. So ano naman po yung mga environmental factors na to? Ang pinaka-common po dito is radiation. The exposure po sa radiation, exposure po sa chemical, at saka ano pa, infection po. Infection. Ang isa sa mga pinag-aralan na po na sakit na pwedeng mag-precipitate po ng cancer, yung tinatawag na EB virus infection po. No? Isang klase ulo ng infection na nagbibigay ng malalaking kulani. And then eventually, yung kulani yun, hindi na lang pala infection. Nagiging cancer na pala yun. Nagkakaroon sila ng lymphoma, nagkakaroon ng leukemia, and so on and so forth. Yes.
Ang My Child Matters, ang isa dun sa mga proponents ng programa na to is a project of the Sanofi Espoa Foundation, yung global foundation ng Sanofi. Ang role namin primarily is really to fund the program. For the interest of everyone, wala po kaming produkto for childhood cancer. We do not manufacture drugs for childhood cancer. This is a pure CSR program of the company. To avoid any suspicion that it is a commercial initiative, it's exactly why we're working very heavily with the My Child Matters program, the pcmc, and all of our other partners, PETA, including the Department of Health. Nakakatuwa po dahil kasi nung una naming nakita yung resulta ng trabaho ni na Dr. Lecciones, ni na Dr. Anastasia at ng Department of Health, bumagsak po yung death rates for childhood cancer. You'll find it in your press release. And I think kitang-kita po yung what the intervention has done for the benefit of the patients afflicted with childhood cancer. So from yung survival rate po from just 16% when we started the program 7 years ago, survival rate now stands at around 78%. Dramatic, super laki po nung increase na yon. And then yung rate of abandonment of treatment, dati po 80% hindi nagtutuloy ng treatment, ngayon po 10% na lang yung hindi nagtutuloy. So those two numbers alone speak for themselves, and we in Sanofi po and the rest of Sanofi Espoa are very, very proud of the accomplishment. Alam niyo po, ito po ay napakalaking programa, and this is something that we continue to share as a good example to all our other affiliates all over the world.
Hapon na ba? Sa inyo pong lahat. Ngayon pong araw, February 4, nakikisa po tayo sa buong mundo sa pag-obserba ng World Cancer Day. By the way, bibigay po lang ako po sa aming paboritong Assistant Secretary. Siya po'y taga-PCMC din. Sir, kiniklaim ka namin. Dahil siya po'y doon din po galing sa Philippine Children's Medical Center. Ganon din si Dr. Marby Apisamis at si Dr. Anastasio ay matagal na namin kasama sa ginagawa namin ditong trabaho para sa cancer sa mga bata sa matagal ng panahon. As I said, ngayong araw, pinupokus ng buong mundo ang problema ng cancer. Kasi ang namamatay sa cancer all over the world is more than TB, malaria, and HIV combined. And yet, isa itong bagay na maaring hindi natin masyadong pinag-uusapan. So, I have prepared a presentation for you to give you certain data ng mga problema ng mga cancer sa Pilipinas, particularly sa mga bata. Next slide, please. Yes, sir, please. Opo, sir. Okay. As a single entity, cancer is the biggest cause of mortality worldwide. Hindi masyadong nakikita, pero it's 8.26 million deaths from cancer in 2012. Global cancer incidence increased by 11% over the last 4 years to about 14.1 million cases in 2012. And this number is equal to the population of India's largest city, Mumbai. Cancer cases worldwide is expected to rise by 75% and will reach close to 25 million over the next 2 decades. So it is an epidemic that I think we need to focus attention to. Next. In children, there are about 200,000 children now that will develop cancer each year. 80% of these children live in developing countries where survival is very low at less than 10%. While in contrast, at least 80% will survive if the child with cancer is in a high-income country. Next, please. In the Philippines, about 3,500 new cases is expected to be diagnosed each year. Late diagnosis can be as high as 70-80% when cure is no longer possible, or can be attained only with most aggressive treatment that most families could not afford. And right now, only 1 in 5 children will be treated effectively, mostly as paying patients. But treatment abandonment rate is still very high at 80%. Next, please. Next. And survival rate, because of this, is barely 2 out of 10 Filipino children. This is not unusual in hospitals. Many of these patients will come at this stage, and many of them not because their parents do not care for them. It is because they don't have the capacity for treatment. It's largely financial. Okay, next. This is because of the high cost of diagnosis and treatment that childhood cancer entails. Many families can be pushed to poverty in their attempt to save their children. Next, please. At PCMC, just like in any other hospital, we observe an increasing number of children with cancer that comes to the hospital. There are right now about 506 children actively being treated for cancer at PCMC. And you can imagine a similar number in many hospitals, major hospitals like is Avenue, for example, or National Children's Hospital. It is the fastest growing population of patients in the hospital, and this number in terms of patient admissions increases by 30% each year. Padami ng padami. Leukemia is a highly curable disease or cancer in children, which accounts for about 40 to 60% of all childhood cancers that we see in hospitals right now. Leukemia at PCMC is the #1 killer of our patients at PCMC, and the number is more than the deaths due to dengue shock syndrome, sepsis, and prematurity all combined. Next. Even worldwide, cancer kills more people than malaria, TB, and HIV combined. And now it ranks 3rd, and I will not be surprised if it will rank 2 in the next few years. Next, please. The poorer patients are most vulnerable, as we have observed at PCMC and many of the hospitals. 77% of cancer patients at PCMC are service patients. They could not afford the treatment without any help from government and from everyone. Only 34% of these patients are telehealth members, and a significant number of them are from far away places. Without financial assistance coming from different sources, many of them will not survive. Inequities in access to care and essential cancer medicines occur globally, particularly in developing countries, and it is also the case here in the Philippines. In more than 70% of the 200,000 newly diagnosed cases of childhood cancer worldwide each year, and most of them comes from low-income countries. Lack of access to effective treatment results in unacceptably low survival rates, which is below 10%. Cancer in children, other than deaths, limits opportunities for schooling and education, and ultimately impeding full participation in the workforce, not just for the children, but for the whole family. Inequities in access to cancer services are known to be closely associated with socioeconomic status, with the poor and vulnerable unable to afford expensive cancer medicines, as well as experiencing other obstacles to access, such as distance to quality treatment facilities. Next, please. Poor diagnosis of childhood cancer can also be equated with too few specially trained doctors and nurses, and the mistaken belief that childhood cancer is too difficult to cure, combined to create very low survival rates in our country. Additionally, in many countries, irrelevant of their resource setting, poor or rich countries, the lack of health insurance and other barriers prevent people from getting access to even the basic cancer care. Universal health coverage to ensure access to health care is a key element of any effort to reduce social inequities in cancer outcome according to the WHO. And it is the hallmark of a government's commitment to improve the well-being of all its citizens. So today, we focus the attention on childhood cancer or cancer in general, particularly in the poor and vulnerable sector of our society. And we focus for this year on 4 obstacles, debunking the myths that prevents the reality of increased survival for this patient. The myths are the following: that we don't need to talk about cancer, while the truth is, whilst cancer can be a difficult topic to address, particularly in some cultures and settings, dealing with the disease openly can improve outcomes at an individual, community, and policy levels. Maaring dito sa atin, ayaw nating pag-usapan kasi napaka-depressing naman. The World Cancer Declaration, Target 5, has the aspiration of the following: that the public stigma towards cancer and cancer patients will improve, and damaging myths and misconceptions about cancer will be dispelled. Kaya nga gusto namin mapag-usapan. Myth number 2 is that there are no signs and symptoms of cancer, particularly sa mga bata, because the early signs of cancer in children are vague and can be very subtle and can mimic common illnesses in children like anemia or primary complex. But the truth is, for many cancers, there are warning signs and symptoms, and the benefits of early detection are indisputable. The World Cancer Declaration Target 6 states a greater proportion of cancers will be diagnosed. This is the hope, this is the aspiration, when still localized to the provision of targeted population-based screening and early detection programs and high levels of public and professional awareness about the important cancer warning signs and symptoms. And the World Cancer Declaration Target 9 aspires that innovative training opportunities for health workers in different aspects of cancer control will have improved significantly, particularly in developing countries. Myth number 3: there is nothing I can do about cancer. This is wrong. There is much we can do about cancer. There is a lot that can be done at an individual, community, and policy levels, and with the right strategies, a third of the most common cancers can be prevented. For example, as Target 3, global tobacco consumption, overweight and obesity, and healthy diets, and alcohol intake, and levels of physical inactivity, as well as other leading exposures to risk factors will have fallen significantly as an aspiration. and that we need to focus also on vaccinations that are strategies to prevent cancer, particularly papillomavirus that is caused for cervical cancer, and hepatitis B virus that can cause liver cancer or hepatic cancer, and we work that this can be covered by universal vaccination programs. And myth number 4 is that I don't have the right to cancer care. It is a human right to have care. All people have the right to access proven and effective cancer treatment and services on equal terms and without suffering hardship as a consequence. Karapatan natin ang ipagamot at magamot ang mga batang ito. Pero sana sa kanilang pag-abot at pagnanasang magamot ang mga anak nila, huwag sana silang dumaan sa pagdurusang nawawalang dignidad, lalo na ang mga mahihirap. The aspiration of World Cancer Declaration Target 1, health systems will be strengthened to ensure sustained delivery of effective and comprehensive people-centered cancer control programs across the life course for all in all countries. Target 7 is that access to accurate cancer diagnosis, appropriate multidisciplinary treatment, supportive care, rehabilitation, and palliative care services, including availability of affordable essential medicines and technologies, will have improved for cancer patients in all countries. And Target 8 is that effective pain control measures and distress management will be available to cancer patients in all countries. Next slide, please. The barriers to access to care for children with cancer must be dismantled. Ito yung gusto naming ilabas ang boses ng mga pasyenteng dumadaan sa proseso at transaksyon kung paano ginagamot ang kanilang mga anak. I want to share you an actual story of a patient, 2 patients at PCMC. Maaaring ito isang extreme, pero marami sa kanila ganito. This is the story of Kevin, not his real name. Like every child, he has the right to play, and the 7-year-old Kevin is no exception. As an active boy, he enjoyed his childhood so much together with the other boys his age in the neighborhood. As is the case in most poor communities, the streets are often their playground. And that entirely unexpected, he met an accident when a motorcycle hit him, fracturing his left leg, leaving him in a cast for 1 month in an orthopedic hospital. Then, the family's fate afterwards turned for the worse in a bizarre twist in a story usually made for stock in movies. 2 months after that accident, he still could not walk, and a mass in the same left leg was noticed, prompting them to return to the hospital. After several tests, he was diagnosed with average risk acute lymphoblastic leukemia, or ALL, and chemotherapy was advised. The parents decided instead to bring him home because the family could not afford the cost of treatment. Kevin was brought to pit healers, and the parenteral folk medicine was tried. He progressively became cachectic, or very, very thin, and his left leg mass grew bigger. This finally pushed his parents to bring him to pcmc 1 month after the diagnosis of the disease. Already late. Next, please. He is the second of 4 children of a 38-year-old father who is a minimum wage earner in a privately owned company in Manila, and a 35-year-old housewife who is also a chronic asthmatic. The family lived in a remote and poor village in a province 1-hour bus ride north of Manila. Taga Bulacan ang pasyente ito. His treatment was supported with funds from My Child Matters program at PCMC, and later also from the NCPAM Olma. But the economic difficulties of their daily life struggles began to wear and later tear the family apart. Because Kevin could not walk, the mother, despite her being an asthmatic, had to physically carry him up for the 1-hour travel on foot to the place where they could hitch another 1-hour bus ride to Manila. Hindi siya makalakad. kailangan nilang may tatawaring dalawang sapa yata. Pagdala lang niya sa PCMC. Kanyang bibit-bitin ang asthmatic na nanay. Lalakarin nila ng isang oras, makarating sa highway kung saan isang oras na naman papuntang PCMC. Maraming ganon. The father was left to tend to the other children at home. The father, because of depression, got involved in a brawl and was imprisoned for a few weeks. To escape retaliation from his enemies, he went to work as a fisherman in his home province in one of the islands in central Philippines. If I'm not mistaken, umuwi ng Cebu ang tatay. Irregularly sending major amounts back to his family. Kevin was not able to go back to school where he was in first grade. His siblings stopped schooling too and engaged in odd jobs. But his mother never gave up and continued the treatment. Unfortunately, the mother's relatives are helping them out financially. Kevin is now in his 9th month of maintenance, chemotherapy, and is in continued clinical remission despite the late diagnosis. He still maintains his childhood innocence and his faith, nurtured by the love, devotion, and strength of his mother, and their positive attitude could probably put him back in normal track with all of the support now available to them. Many others are not as fortunate. The next story is that of Giselle, who is a completely healthy 10-year-old girl before her diagnosis of ALL in July 2012. This most caring, 2013. This most caring and sweet child is the second among the 4 children of a 35-year-old minimum wage construction worker and his 31-year-old housewife. The third child, the third child in this group of 4 is an 8-year-old boy with partial blindness due to congenital cataract. So meron ng bulag na kapatid, meron pang may cancer ngayon. Despite their poverty, the family never stopped to make their simple home in the inner city filled with love and joy. Kalookan niya sa pamilya. This picture will change in an instant. Tragedy first struck them when Giselle's mother died of a heart illness. Barely 3 months after her mother's death, Giselle was diagnosed with ALL. Their world in a moment suddenly turned upside down. Right after her mother's death, Giselle started to tire easily. Fever and abdominal pain came later, becoming persistent with each day's passing. She started missing school, where she was in 2nd grade, until she finally dropped schooling. And due to financial difficulty, she was managed at home with antipyretics and analgesics. Her father also started to miss days of work to care for Giselle kasi nawalan na nga ng asawa. Fortunately, her grandmother moved in to help care for Giselle and her other siblings so that the father could go to work. Otherwise, they would have nothing to sustain their daily lives. 2 months after the initial symptoms, she grew weaker with more pallor, prompting the initial consultation in the hospital, where she was finally diagnosed with ALL after several tests. Since she could not afford treatment, she was brought home where the grandmother tried herbal medicine and folk healing to no avail. The grandmother had to stop selling vegetables for a living to care for Giselle full-time, while her father worked long hours to sustain the family needs. Their situation became unbearable to a point of hopelessness. Nag-drugs ang tatay, which caused him to lose his job. The eldest sibling, 14-year-old girl in 2nd year high school, stopped schooling and sold vegetables together with the grandmother. With her insistence, the grandmother courageously stood up and took Giselle to PCMC, where chemotherapy was promptly initiated with support of funds from NCM and Insipang Olma, and the clinical remission was successfully attained. Giselle is now in her maintenance chemotherapy, but her happy disposition was lost and is now replaced with gloom that can only be revealed in the sadness in her eyes. Palagi talaga siyang malungkot. Hindi nagsasalita. It is hope that with the support that is now available to them, the family can be healed back from the trauma that no one in their family was spared. Next. So mamaya, at 3 o'clock, and then again at 7 or 8 in the evening, this type of stories will be shown here in the theater of what is typical to 77% of our service patients, ang kanilang mga istorya halos hindi nagkakaiba. Cancer in kids is curable. It has been proven that cancer is curable even in resource-poor countries, and it is possible to save lives of at least 50 to 60% of children with relatively simple and expensive drugs and procedures known to doctors already for decades. Wala namang bagong gamot ng ginagamit namin, unlike the other diseases like breast cancer. MCM Philippines and PCMC in partnership with the DOH demonstrated that by mobilizing all stakeholders for concerted action, early detected cases now increased, at least at PCMC, to 70% from 30%, treatment abandonment rate decreased from 80 to 10%, and survival rate improved from 16 to 78%. And this was achieved through sustained public awareness and information campaigns, the development of a referral network of public and private hospitals, and the ALMAP program with free medicine access for chemotherapy, and now with PhilHealth collaboration beginning to come in. So we have demonstrated that with concerted action, we can save these children. At PCMC, let's take a look at these figures in 2013 last year. Out of 268 leukemia patients, which is 53% of all cancer at PCMC, 107 of these 268 leukemia patients, which is 40%, are average risk leukemia. The rest are what we call high risk to very high risk leukemia, 60%. Sa mga ospital ngayon, 60 to 70% are high risk leukemia. Ito yung medyo mas agresibo ang paggagamutan kasi makukure pa rin sila, pero mas agresibo kisa kung average risk ang leukemia. Pero ang pinupunduhan ng PhilHealth natin ngayon ay average risk leukemia lang. Ang sumasalo sa lahat ng pasyente ngayon ay ang DOH and CPAM pre-chemotherapy drug. So panawagan din po namin, nandito po si Assistant Secretary Elmer Punsalan, na wag na po munang itigil ang programa ng DOH hanggang na transition. Kasi sa 2013 na lamang, kung qualified ang 107 patients sa PhilHealth C package for leukemia na ang kwalipikado lang ay average risk, ang na-enroll lang sa PhilHealth in 2013 is only 15 patients out of 107 potentially eligible patients for enrollment, or only 14% were enrolled in the Z package. And 7 out of these enrolled patients were service patients. The other half are paying patients. In other words, kung gusto nating pumasok ang PhilHealth, tayo po'y nananawagan na palawakin at i-include lahat na lang ng leukemia. At wag na munang itigil ang gamot galing sa INSIPAM habang hindi pa naaayos ang PhilHealth. Wala pong pag-asa sila kung hindi ito. Making our voices count. We did town hall meetings with parents of cancer patients. We conducted last year in Davao, Manila, twice in Quezon City, and we intend to do this nationwide until April. Gusto naming lumabas, maintindihan ang problema nila, kasi ang problema nga access to care. And many parents encounter difficulties in seeking diagnosis and treatment for their children. Pare-pareho ang sinabi nila. Ito ang major na mga sinasabi nila. The cost of chemotherapy drugs, major barrier. Nasasagot ngayon dahil may libreng gamot sa DOH na hindi naman forever nandyan. At siya'y mawawala din palagay ko. Kailangan saluhin ng PhilHealth, pero kailangan paghandaan ng PhilHealth. Where to go for quality but affordable treatment is an issue. Ang lalayo, hindi nila alam kung saan sila pupunta. Ang mapupuntang ospital, hindi naman handa. Okay? Cancer treatment facilities are far away and inaccessible, and many have inadequate services. Sa Davao, for example, may isang pasyente, nasa Bohol, napunta ng Davao. Hindi niya alam na meron namang Cebu. Dahil kaibigan niya sa Davao nagsabing, dito ka, magaling dito ang cancer center sa Davao. Other ancillary drugs, mainly antibiotics, are unaffordable for them. Hindi lang naman chemo drug ang kailangan. Nagkakaroon sila ng infection, kailangan din ng antibiotics. Mabuti na lang, sinalo na rin ng INSIP ang antibiotics na libre. Pero yata ang programang ito, hanggang 2015 na lang daw. Pero dapat malinaw, ano ang sustainability natin ngayon? Blood product support, problematic din sa kanila. Sinasalinan po sila ng dugo. Dahil bumabagsak ang kanilang dugo. Nakakatawang isang sitwasyon sa Davao. Doktor, taga Bukidnon po kami. Kailangan po ng sali ng dugo. Hindi po pwede pala nang wala akong daladalang donor. Paano naman ako, doktor, magdadala ng donor? Istranghero ako dito sa Davao, taga Bukidnon ako, dadalhin ko pa mula Bukidnon ang aking mga kaibigan pamilya para pumunta ng Davao para mag-donate. Sa kalilibot niya sa ospital, may mga janitress na awat nagbigay ng dugo. Ito na naman ang problema. Kailangan palang bayaran, doktor, yung screening test. Ni 5 duling, wala ako. Pumunta kami, dok, ng Red Cross. Ganon po, kailangan ko madala ng donors. Yung mga ganitong problema. Malalayo ang lugar. Kung isipin mo nga naman, wala saan kakilala, saan sila kukuha ng donor? Mga problemang kailangan ayusin. The cost of transportation is a problem. Also their board of lodging. Ganon din sa PCMC, mabuti na lamang ang East Avenue mayroong tahan-tahanan na pansamantalang natitirhan. At ito ang nakakalungkot. The attitudes of healthcare workers made them feel they lose dignity in the process of accessing care. Paano, Dok? Pupunta kami doon, sasabihan kami, nangyayari ito, maaaring sa PCMC din na, nilalahat ko na. Sasabihan kami, Mrs. naman, hindi lahat libre. Oo nga naman. Pero, kung yan na may merong pera, hindi yan pagpupunta, manghihingi ng tulong. So, barriers siya lahat. Nasasagabal kung paano natin masisiguro ang survival ng mga patients. We have some solutions that we think work. We have done that already for the last 6 years. For early detection, we have been doing public information like this on the curability of cancer in children. We have increased the capacity of frontline healthcare workers in recognizing the early and often subtle signs and symptoms of childhood cancer. Halimbawa lamang, mga 2 linggo nakakaraan, si Dr. Tricia Alcasabas ng Philippine Society of Pediatric Oncology, nag-conduct, katulong namin at ng mga partners, nag-conduct ng seminar, symposium, workshop sa lahat ng barangay healthcare workers ng Makati in order to detect early retinoblastoma, the cancer in the eye, at para mapadala kaagad ng mabilis sa mga ospital. At magkakandak din kami sa Quezon City at sa Manila as a pilot project na i-involve ang grassroots sa early detection. And we are now giving them information on where to go, what to do. Next, for effective treatment. Build treatment facilities and establish effective referral networks. Nasimulan na namin ang network of 35 public and private hospitals all over the country, pero ang kanilang kakayahan sa bawat ospital iba-iba. May mga ospital na hindi masyado, may mga ospital na kumpleto. Access to free or affordable chemotherapy drugs is partly being addressed now. The issue is sustainability. And we need to develop the manpower competence and establish multidisciplinary team. May mga ospital na wala namang oncologist. Maswerte kung may hematologist, adult hematologist, pwede na rin. Ang iba wala. Di bali, maski pediatrician na naturuan naman sa rotation ng kanyang general pediatrist kung paano bibigay ng chemotherapy. Hindi din maayos ang manpower ng bawat ospital para dito. So this is how I see the whole problem. I see it in terms of demand and supply. As we create the awareness through our public information campaigns, increasing the awareness of people and patients, we are creating an expectation. We said, bring your children early in the disease. Then, as they become aware and educated, they will bring their patients to the hospitals. Okay? They will recognize the early signs. If we involve the healthcare workers for early detection, they will now go to the hospitals. The hospitals will supply that demand. It is inadequate or unprepared. If right now, hindi din natin pagtuunan ng pansin. Appropriate physical facilities for cancer patients. Equipment are necessary. The necessary manpower for cancer specialists should be there. The chemo drugs and other supportive medicines and product support should be there in these hospitals. They should have their appropriate specialists, and they should have, they know how to do this standardized treatment protocols. So, successful tayo dito, nagpuntahan dito, meron tayong access problem. At ang ibang nakaka-access, in the process, it becomes a barrier. Maraming uuwi na lang iiyak kasi nasigaw-sigawan sa mga hospital. Okay? And we need also at the same time create the data and do research in order to understand all of this problem. And so that it can inform policy. So again, as a continuation, today is World Cancer Day, but on February 15 is International Childhood Cancer Day, focused mainly on children, and we will have a patient summit that will be done in Alamesa Eco Park, and there will be an open-air stage presentation again of Punting Saranggola. But the main here, we are all parents, and we have also representatives from parents from the provinces. It will be a big town hall meeting again, making their voices count, at gusto namin idokumento ang mga barriers na nadaanan nila, and hopefully makapag-guide yon in creating a more responsive cancer public health system for them. Idodokumento namin ito at imbitado din namin kayo para marinig ninyo mismo sa kanila ang mga problema. If it should be a people-centered National Cancer Control Plan, we need to consult the very population that is affected by the disease. The 2011 UN Political Declaration on Non-Communicable Diseases that includes cancer recognizes the critical importance of strengthening health systems, including healthcare infrastructures, human resources for health, health and social protection systems, particularly in developing countries, in order to respond effectively and equitably to healthcare needs of people with non-communicable disease, particularly cancer. Kami po nananawagan din sa Department of Health na sana'y isama ang pag-develop ng infrastructure ng mga physical enhancement program ng mga ospital ng para din sa cancer. According to Kerry Adams, the CEO of the Union for International Cancer Control, today we demand that governments around the world move to stop the million of predicted, needless, and premature deaths caused by cancer by developing and implementing a national plan which includes proven preventive and early detection measures. So maraming salamat po. And Chair, maraming salamat.